Welcome to the Prospective Doctor podcast, brought to you by Med School Coach. Each week we cover topics related to the pre-med journey to medical school and beyond, from the MCAT to completing your application and from starting medical school to choosing a specialty. Our podcast will provide essential information for anyone contemplating a career in medicine.
Hi there, it's Dr. Marinelli. Today I am joined by Dr. Joel Ramirez and Dan from Future MD Life on Instagram. Again, I'm so happy to have you guys back. We are going to talk some more about USMLE Step 1. Thanks for joining me again, guys.
Thank you for having me again.
Yeah, thanks for having us.
So today I kind of wanted to talk about your best tips for the steps. So we'll begin with step 1 because this is kind of where we're focusing on. And, as probably most listeners know, step 1 is kind of considered the most important step, even though there's been a lot of attention being paid to step 2 in residency selection. But step 1, I think, still stands as that really big hurdle that most students have to overcome for residency and during medical school. So let's start your kind of pre-preparation for step 1. That would be like during first and second year, where you're still learning the medical school curriculum, you're taking anatomy, you're taking physiology, all of these courses, but some people are starting to think about step 1 there. Joel, why don't you start? What is your biggest tip or maybe, the biggest lesson you learned during those first couple of years of medical school?
Yeah, so thanks for having me, Dr. Marinelli. Always excited to talk. So I think that the tip that I give most often is I think that once you get to medical school, the most important thing is that you're able to transition. So sometimes this can be really challenging if you're coming from across the country or you're going to a Caribbean or international medical school. I think the first focus is just transitioning, becoming comfortable where you are, moving if you're having to move, and then, really getting prepared for kind of a new role. And I think the next most important thing is everyone talks about step 1. So I think oftentimes people get very anxious about it and are always trying to figure out what they can do early on to kind of prepare themselves and put themselves on the path for success. And I always say the most important thing is for them to really focus on what they're learning in school. And so I think sometimes, people get a little over anxious about step 1, but in reality, if they're going to all their classes, if they're really engaging with their courses and they're really learning the material, they're in a way preparing for step 1. So, you can be going through first aid and learning about, reading about CHF, but if you don't go to your lectures or you don't spend the time to really learn and understand what these diseases are and how, the RAS system works, then it's going to be very hard to prepare for step 1. So I always just say, focus on your coursework, kind of enjoy your life, transition comfortably to medical school, and then focus on really learning those important concepts. And that really pays off when you start preparing for your exam.
Yeah, and I definitely agree. It's all about adjusting at the very beginning. Like at the beginning of first year, I think everyone's more worried about how are we going to pass our first exam rather than how are we going to pass step 1. It's such a different way of learning and studying and test taking than I personally have been used to. And there's just way more material. So at first, it's important to just get adjusted, start understanding how you study best when there's a lot of information presented to you every single day. And after that, it takes several months and all the courses are different, especially at the beginning. After that, you could start slowly looking towards the future in like second year and step 1. But at first, go to class, figure out how you learn best, and really just get into medical school mode. It's definitely something that takes time and it's not easy to do at first.
Mm-hmm. Yeah, absolutely. I remember, that whole analogy of medical school is like drinking from a fire hose. And I think most medical schools do a good job at easing people into the volume of material and the difficulty of it, but it is still a huge adjustment. And I think you're totally right. Like, don't go in there just so worried about step 1. Focus on just getting adjusted. Focus on finding your footing, finding a good group of friends, a study group, and things like that. And I think, you're setting yourself up for success in the future. So let's move on to maybe, midway through second year, where probably people are really starting to think about step 1. What is your greatest advice for kind of getting started with that study plan, Dan?
My biggest advice would be to sort through all the resources available to you. There's this common thing, it's called resource overload, where there's so many different things that you can use to help you, and try to figure out which of those things you want to actually use. there's a million different resources to study pathology. There's a million different resources to study microbiology. But find the ones that you're actually going to devote some time to and fully dive into them, or be ready to fully dive into them. Take free trials. Look at how certain question banks are organized. Look at different different like pre-made decks of flashcards, and figure out which ones are you actually going to use when it comes time to really study for step one. That way you're not trying to make all those decisions like when it's too late.
Right. That's a great point. Joel, how about you? Any thoughts on that, or any different advice for kind of that midway through second year?
I think the most important thing is kind of thinking ahead, and I think you kind of nailed it when you said midpoint second year. That's really when you should start thinking about that. I think the most important thing first when you're getting started is kind of what Dan mentioned, is getting your list of resources, together. I think the most common thing that people say when they work with us is, I'm using these 10 resources, and I'm still not progressing. And I totally agree with Dan that at a certain point, when you have 10 different books and 10 different resources, you're really not engaged that deeply into any of them. Mm-hmm. And so you're just you're not able to learn all the material in any of them because you're reading all the same things just in 10 different books. I think one of the biggest things with step one is a lot of the material is really difficult to learn, and a lot of it's not very fun to learn. And so when you're using 10 resources, mm-hmm. you go through the 10 resources, that you skip all the hard stuff or skip all the stuff you don't like. But you do that in all the 10 resources. So you're essentially skipping out on all the things that you should be learning across all those 10 resources. So most important thing is thinking ahead, spending that time to critically reflect, what kind of a learner am I? What are my goals with step one? What kind of scores do I need to do what I think I want to do, or do it where I want to do it? And then identify the resources. That takes a little bit of time and a little bit of research. Like Dan had mentioned, free trial is a great opportunity to kind of get a chance to see what things are like. And then I would even think about making a study plan at that time. Mm-hmm. So mapping out your 2 or 3 months, even if it's not going to start for another month or two, but really, you can ease your anxiety by creating a plan early on. So you know that once your timeline hits that you kind of are ready to go.
Sure. I have a question. Dan, you talked about resource overload, which, I definitely can understand that. There's just so much out there. And I think as you're going through medical school, you have different textbooks and things like that. Is there anything such as like too few resources? Like, what about if somebody just relies on a QBank and first aid? Are they putting themselves at a disadvantage?
So I know some people who do more of that sort of thing. And hey, if it works for them, that's great. I feel like there are resources that specialize in certain things. Like for me to learn, for example, pharmacology, all the medications that are used and everything about them, it's not so easy to do. But then having, for example, Sketchy Pharm with videos and then flashcards that I can do to help me memorize them, that was a great way for me to learn pharmacology. Like, yes, it's included in first aid. Like every chapter has like a pharmacology section. And yes, I read those. And UWorld has questions on the drugs. Mm-hmm. Sketchy Pharm, for me, was a great resource to learn that information and to help me remember it. So I feel like there are ways for you to really learn certain pieces of the exam, like certain pieces of content and whole subjects that are just better or more focused than other resources would have it. So while it's possible, I just think that why not use the most efficient or like the best way for you to learn something? Mm-hmm. It's fine to rely on something, but you really have to know it like perfectly at that point, I guess.
Right. Well. Yeah. So let's move on to, the part where you're knee deep into studying for mm-hmm. step one. You're grinding away, sitting at that desk in the library, as Dan described in our previous podcast, and every day, going through the material, going through QBanks, and just chugging through this studying. What's your greatest advice for somebody for that?
My greatest piece of advice for that? I guess take breaks. These are long days. They're exhausting. But one of the mistakes I made was like not really taking breaks, I guess. I just felt like I had to get things done, so I didn't give myself time to like breathe outside of it. Mm-hmm. I think that it's easy to go crazy studying for step one because you're just kind of locked away in this place wherever you're studying, and that's every single day is like that. My greatest piece of advice is try to break it up a little bit. Like try to kind of have like things to look forward to every few days or like once a week that'll like push you through those days. Because it's something where like the light is at the end of the tunnel in 6 weeks, but it's nicer when there's a little light at the end of the tunnel every week where you're like, just 2 more days and like I could have a nice like half day break or something like that. Like give yourself a schedule that works for you, that is realistic, so you don't kind of feel atrocious for 6 weeks before you take this exam or however long you have to study.
Right. Yeah, absolutely. Joel, how about any thoughts there?
Yeah, so I think the biggest advice, for step one and for medical school as far as kind of surviving and being a medicine student is you really can't stop doing the things that you enjoy doing. So it's different for everybody, but if that's going to the gym, exercising, spending time with friends, family, hiking, whatever your hobbies are, you just can't stop. I think in reality, step one is difficult, but then so is third year, but then so is fourth year, but then so is residency. So I think, if you kind of go in the mindset of you're just going to drop doing everything that you enjoy doing and focus on the task at hand, the tasks don't really stop. And if you do that, then you're never going to continue to do what you enjoy doing. And I think when people are doing what they enjoy doing, they're generally happier and they function better. And then it kind of makes medicine and everything more enjoyable and more rich. So, obviously, if you're spending time 12 to 14 hours a day studying, it's harder to do those things. But you can, block out an hour every day to exercise or, go to dinner or have a meal with your family and your significant other or your friends a few times a week, take a day off or a half day off to go for a hike, whatever it is you enjoy doing and that kind of energizes you, makes you happy. You really want to make sure you do that, particularly for step one studying, because that is such an intense and a challenging part of medical school. And often it's very, very frustrating. You're working very hard and sometimes you're not seeing the progress that you hope to be seeing. And, it can become very discouraging, especially because it's so high stakes. And so it's really important to make sure you take care of yourself. So that also means, you keeping up with your own mental and physical health. So, if you see, a counselor or if you have to see a physician for, some sort of health issue or you see kind of a mental health provider, that's just definitely something you want to keep doing while you're studying. You don't want to drop those out. You really want to make time for those because you're kind of investing in yourself and your health. And in the end, that's really going to pay off.
Yeah, and I totally agree. I mean, the nice part about dedicated or however much time you have to study is that you know that in advance. So if you have a test date scheduled, you can reverse engineer and figure out what you need to get done when. That way you can include things like time to exercise or time to go wherever you need to and time for breaks and not feel overwhelmed or anxious that like you're not giving yourself enough time for things because you can always study more. Like when you're studying something, you're never going to feel 100% prepared. So you can always be doing more forever. Like there's no kind of end point where you're like, I 100% know everything. Like just doesn't happen. So you have to give yourself these schedules where once you're done with that amount of time or like that chapter, like you're good. You've done what you can. And you have your other blocks of time set aside for things like mental health or exercise or eating with family or friends. And that way you're going to be okay with doing that and not feel like you have to study nonstop.
Yeah. Yeah, I think that's such a great point. And I think just keeping yourself well during this time is just so important. It's such an easy way to burn out. And then obviously burning out in any fashion during studying for step one is not going to be good for your production, for your mental health, all of that. I remember when I was studying, and I think, my mind purposely blanked out a lot of my step one preparation because it was so miserable. But I do remember, I went to school in Orange County in California, and, for a while, my spouse and I would go study on the beach or we'd go study by the pool. Those would be like our little bits of joy and our little bits of just away time that we could just have some moments where we're just enjoying ourselves or, at least being out of the house, out of the little cubicle, whatever it may be. I think that's all important too. Or, every day we would take, I think 20, 30 minutes just to have lunch, put down the notes, sit outside, go for a walk, things like that. I think you have to maintain. It's easy to kind of just bunker down, but I think you definitely need to be aware of that and keep that part to yourself. So let's go to, all right, you took the test, you're done, and you feel so good. What about waiting for that score? I mean, that is a nerve-wracking time. What is any, tips or advice for somebody that's waiting for that score, Joel? Or Dan, whoever wants to jump in there?
Sure.
Go for it, Dan.
This is a very common thing. Thanks. This is a very common thing because, everyone has to wait, and it's usually at least 4 weeks before results come out. And I think anyone would tell you that you just have to figure out a way to distract yourself and do other things so that you're not focused every day on waiting for your result. Mm-hmm. I guess what I did, what a lot of students actually that I know did, was plan some sort of a trip for afterwards. Mm-hmm. So I went away it was less than a week, but I went away. So for that week, I wasn't really, I was distracted, so I wasn't focusing on my grade, and I knew it wouldn't come for a while. So I wasn't even checking my email or anything like that. I just knew it wouldn't come. After that, we pretty much started third year. And I think a lot of schools are like that too, where, you start third year and you're busy in, either training for your third year or already in the hospital on clinicals. And you don't really have time to think about step one anymore. It's in the past. Your score is your score regardless. It's not going to change. So I guess I was lucky in that I was able to focus now on my clerkships and being in the hospital. And then when the day came, I was like, oh, today's the day, probably.
Joel?
Yeah, I just agree. I think some people do vacations. I think that's great. Either way you want to make sure you take at least a week off before things get rolling. But other than that, you just have to move on with your life. Most people have to start third year or start thinking about third year pretty seriously within a week or two. So you just got to move on. And unfortunately or fortunately, the thing with medicine is just it's the next thing you have to do. And so I think that kind of gets back to our point earlier that it's really important to keep doing the things that you enjoy and things that make you happy, because once you're done with the task of step one, then you have the next task of third year, which in itself is challenging. And then you have the next task of step 2 CK. So take a week off, have a good time, travel if you can, if you like to do that, and then move on and get ready for the next thing.
Yeah. Absolutely. That's awesome advice. I think this really helps people kind of think about it, put this in, perspective on your whole path through medicine. Thank you guys so much for joining me today and, just getting all this out there. I hope it will help our listeners.
Awesome. Thank you for having us.
Yeah, thanks for having me.
Hey, till next time.
Our mission is to inspire, encourage, and inform students as you journey through a rigorous and intricate process of achieving your dreams in medicine. Visit us at prospectivedoctor.com and medschoolcoach.com for more essential resources in your medical school journey and beyond.